Good morning. Yesterday at the Anamosa State Penitentiary, 2 correctional facility employees tragically lost their lives when attacked by an inmate. I want to ask all Iowans to join me in lifting up their grieving families, friends, and colleagues in prayer. It's hard to understand such a senseless loss, but it's my hope that the prayers of our state may offer some sense of peace and comfort during this difficult time. I also want to recognize the leadership and the staff at the Anamosa facility and the Department of Corrections. This is an extremely difficult situation. You've lost 2 of your own, and I want you to know that all of us stand united and ready to support you. I also want to acknowledge and thank the Department of Public Safety's Division of Criminal Investigation, whose team is on the ground and hard at work to ensure that justice is realized. We will have more details about the situation and the progress of the investigation later this afternoon. It will be shared at a press conference at 3 o'clock at Anamosa. And until then, we ask for your patience and respect for the families. So now we'll go ahead and move into an update on the progress of Iowa's COVID-19 recovery. I'm pleased to report that more than 1.33 million vaccine doses had been administered in Iowa, 86.6%, and we're currently 5th in the nation with vaccine administration. More than 517,000 Iowans are fully vaccinated against COVID-19. 21.3% of Iowa's entire eligible population, age 18 and up, have received a single dose, and that's 6th in the nation. 35% of Iowans 18 and up have had 1 or more doses, 16th in the nation. And 82% of Iowans 65 years and older have received at least 1 dose. Last week, when the CDC began reporting administration rates for individuals 65 and up receiving at least 1 dose of vaccine, there was a noticeable difference between the CDC's numbers and the state's data. As we looked into why this was occurring, we discovered an error in a worksheet staff used for calculation. As a result, the state was reporting a higher percentage of Iowans 65 and older having received at least 1 dose. The percentage reported prior to identifying the error was at 95%. Since then, we have adjusted the calculation, which is the reason for the decrease. But because the state uses Iowa census data to calculate age-specific results, and the CDC uses population estimates, some variability will continue to exist between the reports. Despite this change, Iowa's administration results for adults aged 65 and older rank in the top 10 nationwide. I'm extremely proud of what we've accomplished, and I want to thank our local public health department and the many vaccine providers across the state for making this possible. Your hard work continues to be greatly appreciated by all of us. Yesterday on the White House COVID-19 briefing for governors, we were informed that vaccine allocations would begin to pick up next week. We expect to see an increase in Iowa of about 25,000 doses compared to what we received the last 2 weeks, for a total of more than 128,000 doses of vaccine, and that will include an additional 18,000 J&J doses, which will be used for employer vaccination clinics the week of March 29th, as we had planned. The administration anticipates that we'll receive an even larger allocation of J&J vaccine the week of April 5th, and that should continue increasing during the weeks after that. With this news, I am pleased to say that we remain on target to open vaccination to all Iowans beginning Monday, April 5th. When this occurs, once again, there is going to be more demand than supply at first, just as we've experienced each time eligibility was expanded. So please be patient as our weekly allocations continue to increase, so will the number of appointments available, and soon there will be enough vaccine for everyone. You know, since the start of the pandemic, concern has been raised worldwide about the disproportionate impact of COVID-19 on racial and ethnic minority groups, as well as those who may be socially and economically disadvantaged. Now that the vaccine is available, ensuring equity in its distribution and administration is a national priority. In a report published last week, the CDC noted that in the first 2.5 months of the U.S. vaccination program, which ran mid-December through March 1st, counties with high social vulnerability had lower vaccination rates than less vulnerable areas. While estimates based on county-level data varied widely among states, disparities were observed in the majority of them. According to Iowa's current vaccine administration data on race and ethnicity, 1% of Iowans receiving vaccine are African American and 1.6% are Hispanic or Latino. It's important to note that this information is self-reported, and up to 19% of the individuals have reported their race or ethnicity as unknown. So while it's challenging to know exactly where we stand, we know absolutely that we still have work to do to reach these communities. Based on what we know about the impact social determinants have on health literacy and healthcare access and health outcomes, targeted outreach to minority and other vulnerable communities will better ensure that all Iowans have the opportunity to be vaccinated. To do that, the state is committed to working with individuals and organizations who are trusted leaders and resources in their communities. A great example of this collaboration is between Broadlawns Medical Center in Des Moines, United Way of Central Iowa, and the Corinthians Baptist Church, who together will host a COVID-19 community vaccination clinic this weekend to serve minority populations in Polk County. Today, I am so pleased to have with us Dr. Yogi Shah, Chief Medical Officer at Broadlines, Reverend Dr. Jonathan Whitfield from Corinthians Baptist Church, and they're here to share why this type of community outreach is so important. But before we hear from them, I also want to recognize others who have been so important, have been a really important part of the team that's making this possible. And that's Elizabeth Buck, who is the president of the United Way of Central Iowa, and Wayne Ford, founder of Urban Dreams in Des Moines and former Iowa State Representative, and of course, Polk County Public Health. Together, their unique ability to connect healthcare and community services with faith communities and trusted leaders of color is what makes this type of outreach work, and it's something we hope that we can emulate and do statewide. So to hear how this started and why is Dr. Yogi Shah.
Thank you, Governor. Good morning. I'm deeply honored to talk to Iowans about what and how Broadlawns has created this partnership and what Broadlawns is doing to make a positive impact in our community health, especially for minority community. Broadlawns Medical Center is Polk County's public hospital, and we make sure that the community has access to high-quality health care, which is coordinated, compassionate, and cost-effective. So as Governor mentioned, early on during COVID, we realized that the healthcare disparities, what exists in our community for a long time, will affect COVID-related cases also, and which happened. And with that, we also believe that if we could directly engage these communities to provide the information, resources, and services they needed, we could help make a difference in their health outcomes. So Broadlawns President and CEO, Mr. Jody Jenner, conceptualized Healthier Together. It's a win for all, an initiative to ensure that COVID-related material, PPE, and then when vaccines become available, would be provided appropriately to the minority community. A year ago, as Governor mentioned, Broadlawns community advocate and consultant, retired state representative Mr. Wayne Ford, approached Elizabeth Buck, the president of United Way of Central Iowa, and asked if they could partner with us on the Healthier Together, It's Win for All. And luckily, they said yes, and since then we have done very well together. Some of you might know United Way has an extensive reach out through our community, and they have been an extraordinary partner. Just let me give you some numbers. The Win for All has distributed many multicultural education material. We have given out 16,500 fabric masks to the community. We have given out 11,500 hand sanitizers to the minority community also. And this happened through 50 different non-profit organizations throughout central Iowa. So let me tell you a couple of things we have learned which can help us going forward. We in healthcare have learned that many important lessons, two of them are deeply connected to me. One, that it's important to invest in upstream by addressing social determinants of health. And when I say social determinants, I mean environment in which we are born, we live, we learn, work, and age. Basically, in a nutshell, it's our zip code. And studies after studies have shown that our zip code is more important than our genetic code for our health outcomes, whether it's for chronic conditions or now for COVID-related outcomes. So Broadlawns is addressing these issues by doing multiple programs in the community, and now with Corinthian Baptist Church partnership, and especially with Reverend Dr. Whitfield, we have developed this for chronic conditions. We started with dementia care, and now we are working on COVID-related cases. The second things we have learned nationally, which is very applicable to Iowa, is we need to expand access to our care where people are, in their homes, in the community. And we have seen this, you might have experienced this through telehealth and virtual care. And here, the virtual care and telehealth is here to stay even after COVID is done. So to address this inequality, as Governor mentioned, we have this community clinic on this week, on Saturday. And initially, our goal was 1,000 people. I was quite afraid, knowing the national number. I was afraid we'll probably get about 250 or so, but we are so lucky. Within 48 hours, we filled all the slots. So we will have a very nice, meaningful clinic this Saturday. So in closing, while we recognize that our vaccination clinic is not a solution to multifaceted healthcare inequality problem, it is one of the small but important steps towards building a healthy community. And if this model of faith communities and healthcare communities working together can be replicated in other cities throughout the state or nationally, I strongly feel that we can become the healthiest state when all this COVID is done. And thank you.
Thank you, Dr. Shah. Broadlawn serves an important need in the greater Des Moines community, and I want to thank you and I want to thank your colleagues for your hard work and your dedication throughout the pandemic. And as Dr. Shah mentioned, the best first step is always seeking to understand. Reverend Whitfield knows firsthand that resolving vaccination hesitancy among his congregation in the greater community or with minority populations anywhere in Iowa starts with a willingness to listen and then meet people where they're at. Reverend?
Thank you, Governor, and we're grateful to this partnership that has developed under the theme of being healthier together. Being a pastor in our community as well as other leaders within the minority communities, we were faced with hearing and listening to all of the, what you might call negative comments around the idea of vaccinations. As individuals were rehearsing thoughts in their minds, as well as feelings in their hearts concerning their conditional beliefs about the systems of healthcare within our community. These barriers are real, and we have to face these realities. These barriers are as thick as any wall you can imagine because of the historical data that exist in minority communities relative to experiences with our systems. So we saw and we heard and we felt barriers of stigmatization, barriers of misinformation, barriers of misdirected information, as well as barriers of access to the health care. These barriers needed to be met, and as a church facility, as a church existing within our community, we're beginning more and more to understand the effects that the religious community can have and the assistance in which we can give to overcome these great walls and these great barriers. Lack of this understanding will continue if we do not do anything. Lack of the connection between our represent community and our facilities, our institutional facilities of care and help will continue if we don't do anything. Specifically, we saw great barriers concerning our seniors and their thoughts, specifically around transportation, language barriers, cultural differences between patients and possible healthcare providers, as well as I already mentioned, this historical narrative of discriminational healthcare that has existed. So the church within minority communities has a great representational goal as well as fight to remove all of these things. And we feel that religious institutions adding in their effort will bring about some removal by offering a place of trust, offering an ear of trust, offering a heart of care and concern, as well as representing the possible response to all of these needs that are within the hearts and the minds and the realities of minorities that live in our communities. So working together with Broad Lawns and working with the United Way and the 30+ other minority organizations of our community, we have sought to overcome these barriers. Just to give a few examples, we heard the barrier of technology, specifically with our seniors concerning getting registered for the vaccinations. And so what we offered was the opportunity to continue or to go back to the traditional paper trail. And we said to them, if you will fill out the forms, we'll make sure that we get somebody to do the data entry. This offered immediate response from our seniors that allowed them to feel comfortable about the process and getting themselves ready as well as registered for a vaccination. We offered also opportunities to move past the barriers of language as we dealt with other communities in the minority field. We made sure that we had interpreters that would come and give their assistance, as well as speaking to the hospitals to say, bring forth those representatives who will provide care that are in these different minority classifications so that they will find comfort in getting past the barriers of language as well as any barriers that may be there concerning culture. We're also working towards now, along with our collaborate, to make sure that we get good information towards our community. We know what the history says, we know the barrier that is there because of the history, and we give and embrace it with realities. But now we have advancements. Our medical profession has grown tremendously, and there's a great gap in the advancement of medicine and the advancement of information about the advancement of medicine in the minority communities. That gap needs to be filled as soon as possible, and so we're going to continue, even after this clinic, to begin to offer awareness opportunities, lectures, workshops, Q&As, so that we begin to fill the void of information, so that we can change the narrative of the history and begin to make a partnership that is collaboratively good between the citizens of the minority community and the healthcare professionals specifically. I'm grateful for this because I believe that this is what our religious institutions are all about. We are not adversarial, we are partners, we're collaborates in the health of our community. And without health, we will not get better economically, we will not get better socially. Without health, we will not continue to grow and become the better operational existence of citizens that we should be. I'll close my remarks with a little story. Being a little boy, you all may remember this. There used to be a truck that used to come to the neighborhood carrying ice cream. He would play the song, and all the children would come out running to get the ice cream. What was interesting to me, even as I thought of this illustration along these lines, is that while we were in the house, we may have wanted the ice cream, but there was barriers that kept us from going to the store. Somebody might have thought that maybe if I'd just be intentional about bringing the ice cream to the neighborhood, I'll be able to bring all of those who might want it out of their homes, and they will come to the truck and maintain a relationship of gaining some ice cream. I think that's what we're talking about here with these efforts. The 30-plus companies have joined together, the 30-plus minority organizations have joined together, being led by Broad Lawns and the United Way, and we're just being intentional about bringing what is needed to our community. And as we have brought it to the community, specifically in this first effort, the community has responded. So we're grateful that the community can see the care, the concern, and the response of our collective efforts, and we plan to continue this so that we all can get healthier together and that we all can have a win. Thank you so much.
Thank you, Reverend Whitfield. I am so encouraged by the community's response to the clinic that you're hosting on Saturday. I look forward to visiting. I look forward to continuing to work with you. Our hope, too, is that we can take this example and scale it across the state and continue to help you do the work that you're doing. So thanks for leading. Thanks to your commitment for removing barriers that may have prevented some Iowans from being vaccinated, and for your willingness to lead by example. So again, I hope other faith communities across the state will follow your lead, and that you may have my word that the state will do our part to help as well. So anything that we can do to be a partner, we stand ready. You know, as we've been able to open up vaccination to more Iowans, including those aged 16 to 49 with underlying health conditions, and soon to include all Iowans, we have an opportunity and a responsibility to ensure that we're reaching everyone in all communities across the state. And using the example you just heard about as a potential model for statewide implementation. My team, the Department of Public Health and the Department of Human Rights have reached out to United Ways of Iowa and into communities across the state to support vaccination efforts that, again, will develop those partnerships, increase access and uptake for minorities and other vulnerable populations. This effort is critical to ensuring equity in all corners of our state, and I look forward to providing regular updates on our progress. A variety of services are already available to help individuals who are experiencing barriers to getting vaccinated. We've had nearly 4,000 appointments that have been scheduled through the 211, and that was set up originally for Iowans 65 and older who had barriers to technology, didn't feel comfortable, or were having challenges in scheduling appointments. We've been able to partner with Hy-Vee pharmacies near them to get them scheduled and to get a vaccine. Call volume is decreasing, but demand remains steady, and as this population nears vaccine completion, plans are underway to extend the 211 service to other eligible Iowans in the coming weeks. And in addition to that, bring CPESN Pharmacy Network will be participating in the program as well to increase the number of locations and available appointments. 211's language translation capabilities make it a great source for assisting those who aren't native English speakers, and that's something we're considering as we determine how best to engage minority populations as well. As they mentioned, transportation is another barrier that can prevent individuals from being vaccinated, but there are also solutions there. Federal COVID relief funds are available to cover public transportation to and from vaccination sites. Some of Iowa's 35 public transit agencies are already offering this service. So anyone needing a ride, or community action agencies and other nonprofit organizations that are helping Iowans access vaccine resources, they can contact the public transit agency in their area, or a list of locations and maps for Iowa's urban and rural transit systems are available online at iowadot.gov/transit. So even though Iowa is well on its way to recovery from the pandemic, too many families continue to feel its impact through financial hardship. For those who lost income due to COVID-19 and are unable to pay their mortgage, rent, or utility bills, the possibility of losing their home to foreclosure or eviction is a harsh reality, and the long-term financial and emotional consequences can be devastating. Today, I'm pleased to announce that we'll be launching 2 programs that will provide critical assistance to COVID-19 impacted renters and homeowners. Here to share the details is Director Durham. She's Director of Iowa Economic Development Authority and the Iowa Finance Authority. Debbie?
Well, good morning, and thank you, Governor. So now for all the details that I'll be sharing with you. The first program is the Iowa Rent and Utility Assistance Program will provide eligible COVID-19 impacted renters with help with rent and utility bills for up to a combined total of 12 months. The program is funded through a $195 million allocation made to IFA through the Federal Emergency Rental Assistance Program, administered by the Department of Treasury. The program was enacted by the Consolidated Appropriations Act of 2021, which was passed by Congress late last year. Rent assistance will be available through the program can include past due payments and up to 3 months of future assistance requested at a time. The utility assistance can include past due payments only. Eligible utility types, and it's quite inclusive, include electricity, natural gas, propane or fuel oil, water, sewer, and/or trash removal. All past due rent and utility assistance must be for cost incurred no earlier than March 13th of last year. To be eligible for assistance, renters and households must have a household income of no more than 80% of the area median income, which will be calculated automatically as part of the application process. Additionally, one or more individuals in the household must have either qualified for unemployment benefits or experienced a reduction in household income, incurred significant cost, or experienced other financial hardships due directly or indirectly to COVID. And finally, the household must also be able to demonstrate a risk of experiencing homelessness or housing instability, which may include a past due utility or rent notice, or even, unfortunately, an eviction notice. It is also important to note that Polk County and the City of Des Moines are administering a local emergency rental assistance program themselves. Because of this, residents of Polk County and the City of Des Moines need to apply to that program at impactcap.org directly. Now, once funding for the local program has been exhausted, the state program will open up applications for Polk County and the City Des Moines residents at that time. Renters in need of assistance should take the following steps. Visit iowahousingrovery.com and take the eligibility pre-check for renters. Renters who meet the initial eligibility criteria will then be asked to provide their email address or phone number to be notified when the full application is available, which will happen on this coming Monday. Applicants should begin gathering the required income and eligibility documentation that will be required for the full application. Finally, renters should notify their landlord of their intent to apply. Landlords will be required to complete a portion of the application to initiate processing of the actual application. Payments will then be made directly to the landlords and the utility providers through the ACH payment portal. To ensure that we provide assistance to Iowans as rapidly as possible, we are continuing our highly successful partnerships that served Iowans so well in our first round of relief programs last year. For example, we will again be partnering with the Iowa Legal Aid to provide free legal assistance for renters who call or apply online who are at immediate risk of eviction. The Iowa Rent and Utility Assistance Program application is expected to remain open until at least September 30th of 20 and 21, unless we hear otherwise. I'm also pleased to share that Governor Reynolds has allocated funds to make sure our foreclosure prevention assistance available for homeowners, we can continue to run that program. So it will be opening at the same time on Monday. Mortgage assistance available through this program can include up to 4 months or a maximum of $3,600 per eligible household. This program will be open until the funds are exhausted, or quite frankly, until the new federal home ownership assistance program becomes available. Unfortunately, that is not available right now. The application for both programs were open Monday, March 29th, and I'm told exactly 2 o'clock. Not sure why 2, but it's at 2 o'clock at iowahousingrovery.com. We look forward to assisting renters and homeowners in need. Thank you.
Thank you, Debbie. Your team has worked extremely hard over the past year to assist Iowans in a whole variety of ways, and the positive impact you made can honestly be felt all across our great state. So thanks for helping our state, its businesses and families to recover. So in the closing days, I want to remind Iowans who may have recently traveled out of state for spring break to monitor your health. If you've been experiencing any symptoms of illness, stay home. Get tested for COVID-19. If you're positive, isolate from others as directed. If you could be at risk of a more serious illness, ask your doctor about the monoclonal antibody treatment right away. They are readily available and they are highly effective at reducing the severity of the virus, but you must be treated very early on in your illness. Finally, get vaccinated as soon as you're able. It's the best defense against the virus. It will help get life back to normal for you and others very soon. And so with that, I'll go ahead and open it up to questions.
Governor, gun violence has been in the news recently with a couple of high-profile mass shootings around the country. Right now, there's a bill on your desk that would make it optional for Iowans to have a permit to buy or carry handguns. And people are worried that this would make it easier for dangerous people to get guns. Do you think those concerns are valid, and do you plan to sign the legislation?
Well, you're not going to be surprised at my answer, so I'm waiting for that to come to my desk. We'll do a thorough evaluation, as I always have. I've been pretty clear that when we're talking about gun violence, we need to take a holistic approach. There's not a single answer. We need to be following the laws that are on the books. We need to make sure that coordination is in place between the agencies. We need to do everything we can to be proactive in just addressing mental health and behavioral health issues. And I'm proud of the continued progress that we've made in that arena. We have in that area. We still have a lot of work to do, but we have really, did comprehensive reform to our adult mental health system. Our children's mental health system is in place. We're actually opening up our access centers across the state to help Iowans get stabilized, get them the treatment that they need, keep them out of prisons. Education continues to be a priority. And, our campaign, See Something, Say Something. So, we'll continue to take a look at take a look at everything, and then we'll make a decision. We're reviewing the bill right now.
A couple of years ago, you said that you thought current gun laws were good policy, and actually, when you were a member of the Senate, I believe you voted for the permit process that's in place. Do you still think Iowa's current gun laws are good policy?
Well, I think, as I said, too, in most of the comments, and I went back to verify this, I said I thought the policies were good that were in place, but I will continue to take a look at new legislations that is presented. And I think that's the appropriate approach, and that's what we're doing right now. And I've been very consistent in my messaging on that.
Governor, when you look ahead to that April 5th goal where you can expand this up to a lot more people, can you explain to people how you determine the balance here? So that could open it up to quite a few more people. Some of the more higher risk folks are still not fully vaccinated. So can you talk about how you make that decision and why it's okay to do this before the other ones are fully
So we've kind of
vaccinated?
had 70% as kind of our benchmark to move forward, and I've talked about we've hit that with our 65-year and older population. We've hit that with educators and their staff, our first responders, our daycare providers at a ballpark. So we opened it up to 18 to 64 with underlying conditions, which is a large segment of our population already. So when you take into account those statistics, we're already addressing a lot of people. We went 1 week longer, Dave, to make sure that the allocations were going to be what they said that they would be. And the White House confirmed on the call yesterday that they believe that they'll meet those projections. And then there's just some other efforts that are working with the dialysis community to do some proactive outreach to make sure that we're getting to the individuals that are most at risk and figuring out a way to get them involved. And our local public health and our doctors and clinics and hospitals, they know the population in their communities, and so they also can be a very valuable resource in helping really identify that population and making sure that we're encouraging them to get the vaccine to protect themselves. and to hopefully get life back to normal. So like this week, or for the week of March 29th, our projection is 128,130. Now, that did include some one-time allocation of Pfizer. They were very clear about that, 2.1 doses. That is first and second, so divide that in half. And then we'll get another, that's nationally, that's national figures. And then we'll get an additional 2 million doses of J&J. And we also had the opportunity, a small group of governors, to talk to the CEO of the Johnson & Johnson yesterday on the phone, and they are making every single effort to make every projection that they've been saying that they could make, and that was the 20 million projection, as well as the 100 million doses available in June. And so, he said, things come up, but they are doing everything that they can. The partnership with Merck was instrumental, and then it's also working with, the vials and the instruments that it takes to process and to get it allocated out to states across the country. So we're seeing not only our allocation increase, but our retail pharmacy partners, they're seeing theirs increase a little bit. We're seeing additional pharmacies being brought into that as well. So you're going to continue to see additional providers being brought on board. And the other thing that General Perna brought up on the call, and this will be good news too for our clinics and for our hospitals, the fact that they're trying to have the doses be in smaller quantities. So right now Pfizer is 1,000 in the flat, and they're trying to get that down to 250. And that will be, I think, really instrumental in helping us distribute and meet the need that we're seeing, because that is tricky with the Pfizer because of the amount that's they have to send out. And so I think all of those are it's very positive news moving forward.
Governor, may I ask, so I think one of the issues that people may want to know about is how, we're already having issues with people getting signed up and vaccinated. It's difficult, it's frustrating. People just feel like it's hard to do. And I even heard about people maybe driving from like a metropolitan area like Des Moines to a rural county.
Yeah.
Is there a reason why? I guess that my question is, how is the distribution determined? Is it by population? And maybe you can talk about how are people just going to get into the system without experiencing a huge frustration?
Well, it still comes down to supply, David. And you heard me say we're at, I think, what are we right now? We're doing it. It's not me. It is all of our local public health on the front lines, and all of our providers and all of our hospitals and clinics and religious communities working together to get these vaccine clinics set up, to be able to implement the vaccine. We've got the 211, Hy-Vee. A lot of our providers are continuing to enhance their system to register. As we see more doses come in, you're going to see that weight continue to decline, but it is a supply and demand issue, and it's going to be for a while. So I think I said that in my remarks. Even as we open it up to additional Iowans like we have before, the request is going to be smaller than the demand, but as those numbers continue to increase and we continue to get the allocations into the state, we're going to continue to see that timeline open up more and more Iowans be available. So it's a number of things. It's based on population. It's kind of how we did the original allocation. As we've gotten additional doses, we've tried to figure out through strategically how do we get those to the next tier. So it was manufacturing. We were focused on ag and food production, manufacturing suppliers. How do we take advantage of a single dose in J&J and get that out to get those individuals vaccinated? And once we hit that target, then we can move right into the next, and we're to the next phase, the next group, and then balancing different areas of the state. So some of our rural communities are ready to move to the next phase, and some of our larger communities aren't. And so continuing to take that excess vaccine and then figure out how we can address some of the backlog, and like in Polk and Cedar Rapids and Waterloo and Davenport. And I think I said last week, 211 was actually doing that. Hy-Vee was able to actually do that on the fly. It's going to be nice to bring CPESNEN or whatever, excuse me for getting those letters mixed up, into the mix as well. But as we saw that they were, there was more requests than there was appointments, especially in Cedar Rapids and Des Moines, they were able to adjust and move additional vaccine to those areas so that we could meet the need. And they're continuing to do putting those kinds of efforts in place. So, we're...
What the wait time might be? I know you can't do that accurately, but
Yeah,
but as of April 5th, as people start really everybody getting into the system.
We have a
Let's
sys-
set a realistic expectation that the wait time could be a while, right? I mean, it
Well,
could take a while.
we've tried to level set expectations from the very beginning. I mean, do you remember we started out with 19,500 vaccines, and that was for healthcare professionals and our first responders and our long-term care facilities. So, you know, as we identify the numbers in the population and we work through the tier, then we move to the next. And every day, they're enhancing the programs and how we reach out, but it still comes down to the number of vaccines that we're able to get into the state, out to the communities, and in the arms of Iowans. And we continue to work on that every day. Thank you.